Hi, my name is Laura Whitburn and I teach anatomy at the Bundoora campus.
In this video we're going to look at the components of the lower limb. This is an anterior and a posterior view of a model of the lower limb, and it's showing us muscle groups, it's showing us some bony landmarks and some joints, as well as some neurovascular structures. We can use this to divide the lower limb into different regions. Posteriorly and most superiorly is the gluteal region. Then there is the thigh region. Here is the leg region. The leg is located between the knee and the ankle. And then finally would be the foot. And we can again see these regions anteriorly. We can't see the gluteal region because it's posteriorly, but we can see the anterior thigh, leg, and the foot. Here is an image of a skeleton. This skeleton has been color-coded so that the axial skeleton is in yellow and the appendicular skeleton is in green. The lower limb, which is part of the appendicular skeleton, is located here, and from this image we can see that the lower limb begins with a hip bone. Two hip bones together form the pelvic girdle, so it's via the pelvic girdle that the lower limb connects to the axial skeleton, and the joint at which it connects is known as the sacroiliac joint. This video here is again showing us the skeleton, and we can see part of the axial skeleton, some lumbar vertebra and the sacrum, and here is a hip bone where the lower limb would commence. Together with the other hip bone, it's forming the pelvic girdle, and there is the lower limb that continues all the way down until the foot. This diagram here is to allow you to check whether you know the names of the major bones, joints and regions of the lower limb. Have a go at filling in each of the boxes. Some of them relate to bones, some to joints, and some to regions or components. And for any boxes that remain blank, you may like to refer to your textbook to help you. This first box here we'll fill in together. This is indicating this part of the lower limb here, which is formed by the two hip bones, so it's referring to the pelvic girdle. There are a number of anatomical spaces in the lower limb. If we just revise the concept of an anatomical space, this relates to principles A1 to 3. An anatomical space is a three-dimensional space in the body. It has boundaries such as walls or a floor or a roof. It has openings to allow things to get in and out of it. And it has contents, and that is what's travelling in and out of the space. And the ultimate function of an anatomical space is for communication between different regions. So there are four major anatomical spaces that we're going to discover in the lower limb. The first is located on the anterior thigh, known as the femoral triangle. It's a triangular space, although it's actually a pyramidal shaped space, and the apex of the pyramid is actually down at the bottom. The femoral triangle leads into a tubular space known as the adductor canal. And the adductor canal then leads into the posterior aspect of the knee. So over here is the posterior knee, where we will find a popliteal fossa, another anatomical space. And the final space is located on the medial aspect of the ankle, known as the tarsal tunnel. And it's a tunnel that travels in this direction underneath this soft tissue structure. So we can imagine that the major neurovascular structures that are supplying and draining and innervating the lower limb are going to travel through these spaces as they make their way down the limb. A major function of the lower limb is to support the weight of the body with minimal energy expenditure. When standing erect, the centre of gravity lies here, anterior to the edge of the S2 vertebra in the pelvis. A vertical line through the centre of gravity down to the ground lies slightly anterior to the sacroiliac joint axis, posterior to the hip, anterior to the knee, and anterior to the ankle joint axes, and directly over an almost circular base of support formed by the feet on the ground. The way that many of these joints in the lower limb are designed means that they are held in position by the line of gravity, which helps to reduce the amount of muscular energy required to maintain standing position. And we'll understand more about how each joint's design and how the line of gravity affects it as we stand when we examine each joint individually. So here is another diagram showing the line of gravity in relation to the axes of the major joints of the lower limb. So there's the axis of the sacroiliac joint, the hip joint, the knee joint, and the ankle joint. And we can see that it's lying anterior to the sacroiliac joint, posterior to the hip, anterior to the knee, and anterior to the ankle joints. If we now look at the ankle joint and the effect that it has on the ankle joint. So the line of gravity is like a downward force that is pulling the body above it in that direction in relation to the axis of the joint. So because it lies anterior to the ankle joint axis, it's pulling the body anteriorly in relation to the ankle. So it's making the body want to fall in this direction. And if we look at what movement this has created at the ankle joint, it's a dorsiflexion movement. So we call this a dorsiflexion moment that has been created by the line of gravity. So to maintain upright stance, certain structures around the joint will oppose that dorsiflexion moment. It will usually be structures on the opposite side to the way that the joint is moving. So in this case, structures on the posterior side of the ankle joint. Can you perhaps think of what structures lie posteriorly that could oppose this movement? They will be the plantar flexor muscles, such as gastrocnemius and soleus muscles, that can oppose this movement in order to maintain upright stance. I'd now like you to have a go at applying this same idea to the sacroiliac joint, the hip joint, and the knee joint. And you can post your ideas on the discussion forum to get some feedback. A second major function of the lower limbs is to move the body through space, and this involves the integration of movements at all the joints in the lower limb to position the foot on the ground and to move the body over the foot. So it involves complex movements of the joints of the lower limb, it involves coordinated action of multiple muscles, and of course an effective nervous system to control those muscles and monitor the movements. By understanding the anatomy of the lower limb as we work our way down the limb, you'll be able to consider these concepts regarding gait and biomechanics that you may be considering in other subjects.